Welcome, and thank you for taking the time to learn about health literacy today. This journey is all about empowering you with the tools and knowledge you need to feel confident in navigating your healthcare. Think of this as your personal guide to wellness. Now let's start with a simple idea. What is health literacy? At its core, it's about understanding and using health information to make informed decisions. It's not just about reading, it's about connecting the dots between what your doctor says, the instructions on a medication bottle, and the steps you take for your health. Remember, knowledge is power, and health literacy is your secret superpower. Let's explore how you can harness it. Health literacy is about being in the driver's seat of your health journey. It's knowing how to access the right information, make informed decisions, and use that information to take action. It's not just for medical professionals, it's for everyone. When you understand health information, you can manage your health better, avoid unnecessary stress, and even help others in your life. And guess what? You're already taking the first step by being here today. So why is health literacy important? Think of it as the key to unlocking your confidence in the healthcare world. When you understand your health, you can ask the right questions, know when to seek care, and even help prevent health issues. It's the difference between feeling overwhelmed at a doctor's office and knowing exactly what to ask and expect. This knowledge saves time, reduces anxiety, and can even save lives. Let's dive into some of the common challenges people face when it comes to health literacy. These obstacles aren't always obvious, but they can have a big impact on how well someone manages their health. The good news is that by understanding these challenges, we can work to overcome them. First, let's talk about medical terminology. Have you ever heard your doctor say something like hypertension instead of high blood pressure, or myocardial infarction instead of heart attack? These terms can feel overwhelming, almost like a foreign language. When we don't understand the words being used, it's hard to make sense of the diagnosis or treatment plan. Another challenge is navigating health insurance. Insurance is supposed to protect us financially, but sometimes it feels like a maze. Terms like premium, deductible, and prior authorization can confuse even the most experienced patients. You might wonder, is this covered? What do I have to pay? Who do I call to get answers? This confusion can delay care or lead to unnecessary expenses. Then there's the challenge of communicating with healthcare providers. In a doctor's office, time can feel so short, like you have to rush through your questions. Or maybe the provider explains something quickly and you're left nodding your head but still feeling unsure. It can feel intimidating to stop and say, "Wait, can you explain that again?" And finally, let's not forget access to reliable health information. In today's world, we're just a few clicks away from an overwhelming amount of information, but how do you know what's accurate? Some websites or advice you find might not be based on science, which can lead to misunderstandings or even harm. These challenges are real, and they're not limited to any one group of people. They can affect anyone, regardless of education or background. They're also interconnected. For example, if you don't understand medical terms, you might have trouble asking questions during a visit. Or if insurance is confusing, you might delay getting care altogether. But here's the hopeful part. Every single one of these challenges can be addressed with the right tools and strategies. As we move forward, we'll talk about practical ways to overcome these barriers and build confidence in managing your health. So let's take this journey together, one step at a time, and turn these challenges into stepping stones. You've got this. Let's take a closer look at the red flags that might signal challenges in understanding and managing your health. These are warning signs that, if ignored, can lead to bigger health issues. Recognizing them is the first step toward taking control. One major red flag is misunderstanding medication instructions. For example, you might not know whether to take a medication with food, how much to take, or when to take it. Misinterpreting these directions can lead to skipped doses, overdoses, or stopping a treatment too early, putting your health at risk. Another red flag is not understanding the reason for a prescribed medication. If you're not clear on why you need it, it's easy to lose motivation to take it as directed, which can affect your treatment and overall health. These challenges often connect to frequent missed appointments. When you're unsure about your care or feeling overwhelmed, you might delay or skip follow-ups with your doctor. This can create a cycle of unmanaged health issues and worsen your condition over time. Feeling unsure about navigating health insurance is another big red flag. Words like deductible, copay, or out-of-pocket maximum can sound like a foreign language. If you're unsure about what's covered or how much you owe, you might hesitate to get the care you need, leading to delays in treatment. Sometimes red flags appear during conversations with your healthcare provider. You might leave an appointment realizing you didn't fully understand the advice or instructions. Worse, you might have felt rushed or intimidated, preventing you from asking important questions. These missed opportunities can result in frustration and a lack of confidence in managing your care. Finally, there's the issue of misinterpreting health information from unreliable sources. In today's digital age, it's easy to find conflicting or inaccurate information online. Not all websites are trustworthy, and relying on bad information can lead to harmful decisions. These red flags are not signs of failure, they're opportunities to improve. By recognizing them, you can take action, whether it's asking more questions, using trusted resources, or seeking help from your provider. Remember, you're not alone in this, and learning to spot these challenges is the first step toward better health literacy and a healthier life. Now that we've identified the challenges, let's focus on strategies to improve your health literacy. These are practical steps you can take to feel more confident and in control of your healthcare journey. First, improve your health literacy by engaging in more activities that build your knowledge and confidence. Think of it as a skill you can develop over time. You can start by attending health workshops, reading trusted health materials, or even watching educational videos from reliable sources. The more you engage, the more empowered you'll feel to make informed decisions about your health. Second, break down complex information into simpler parts. Healthcare can feel overwhelming with all the jargon and instructions, but you can make it manageable. When you receive information, take a moment to process it in smaller chunks. Write it down in your own words or ask for a simplified explanation. Remember, it's okay to say, "Can you explain that to me like I'm 10 years old?" Next, ask questions. Asking questions is one of the most powerful tools you have. Don't hesitate to say, "I don't understand," or ask your provider to clarify something. Questions like, "What does this mean for my health? How should I use this medication? What are the next steps?" can help you leave an appointment with the clarity and confidence you need. Finally, use reliable resources. The internet is full of health information, but not all of it is accurate or safe to follow. Stick to trusted websites, such as those from government health organizations or well-known medical institutions. If you're not sure where to start, ask your doctor or pharmacist for recommendations. By following these steps, building your knowledge, simplifying information, asking questions, and relying on trustworthy resources, you'll be well on your way to improving your health literacy. Each small step brings you closer to understanding and confidence in managing your health. Let's keep going. You're doing great. What challenges can arise when individuals have low health literacy? Is it A. Difficulty understanding medical instructions. B. Limited access to reliable health information. C. Ineffective communication with healthcare providers. Or D. All of the above? Take a moment to think about it. If you said D, you're absolutely right. All of these are common challenges that people face when their health literacy is low. Let's take this a step further. Imagine how these challenges could impact someone's life. Struggling to follow instructions might lead to medication errors. Not knowing where to find reliable information can result in bad health decisions, and poor communication with providers can delay care. These are serious consequences, but they're preventable. The good news is, as we've seen, there are clear steps we can take to address these issues. By improving health literacy, we're not just solving problems, we're building confidence, independence, and better health outcomes for ourselves and others. Great job thinking through this question. Let's keep moving forward to see how we can put these strategies into action in real-life scenarios. Let's talk about a real-life example that shows how health literacy can impact someone's life. Meet Emily. She's 36 years old, and like many of us, she's balancing work, family, and her health. During a routine checkup, Emily's doctor discovered she had extremely low vitamin D levels and prescribed her a new medication. But here's where things got tricky. The instructions for her medication were filled with medical jargon and complex instructions. Terms like IU for dosage, with meals, without specifying what kind, and warnings about potential side effects that were hard to understand left Emily confused. She wasn't sure how or when to take the medication and felt too embarrassed to ask questions at the time. Over the next few weeks, Emily's confusion grew. She wasn't consistent with taking the medication, and at one point, she even took a double dose, thinking it might catch her up. Unfortunately, this led to some uncomfortable side effects. Emily felt frustrated, overwhelmed, and even a little ashamed that she didn't know how to manage something that seemed so simple. This story isn't unique to Emily, it happens to so many people, and it's not about intelligence or education, it's about access to clear, understandable information and feeling empowered to ask questions. So what could Emily have done differently? What could her doctor have done to make this process easier? These are important questions to consider, and they highlight why health literacy is so crucial. As we move forward, let's explore what Emily could have done to advocate for herself and how we can use her story as a guide to improving our own experiences. Emily's situation is a reminder that health literacy isn't just a skill, it's a lifeline, one that can help us avoid unnecessary stress, complications, and even harm. Now let's look at specific steps Emily, and anyone else in her position, could take to turn this situation around and feel more confident in her care. Now that we've explored Emily's story, let's talk about the steps she could have taken to advocate for herself and avoid the confusion and challenges she experienced. These steps are simple yet powerful, and they can be applied by anyone in similar situations. First, Emily could have asked specific questions about her medication. When the doctor prescribed the vitamin D supplement, Emily might have asked things like, "What is the exact dose I should take and when? Should I take it with food or on an empty stomach? What side effects should I watch out for? Will this interact with any other medications I'm taking?" These are great questions because they give you clarity and help avoid any guesswork. Second, she could have kept a medication log. A log doesn't have to be fancy. It could be a simple notebook or an app on her phone. By writing down when she took each dose and how she felt afterward, Emily could have tracked her progress and identified any patterns, like side effects or missed doses. This log would also have been useful for her doctor to review during follow-ups. Third, Emily could have requested regular check-ins with her healthcare provider. This could be as simple as scheduling a follow-up appointment to review how she was managing the medication. These check-ins are an opportunity to ask more questions, address concerns, and ensure the treatment plan is working as intended. Finally, Emily could have used trusted resources to learn more about her condition and medication. Websites like those from the CDC, Mayo Clinic, or other reputable health organizations are great places to start. These sites provide clear, evidence-based information that can fill in the gaps left after a doctor's visit. Emily's story shows us that health literacy isn't just about knowing medical terms. It's about feeling confident enough to ask questions, take proactive steps, and stay engaged in your care. The more you advocate for yourself, the better your outcomes will be. As we come to the end of this journey, let's take a moment to reflect on what we've learned. Health literacy is a superpower. It gives you the confidence and tools to navigate the healthcare system, communicate effectively with providers, and make informed decisions about your health. We've discussed the challenges people face, from confusing medical terms to navigating insurance, and we've explored actionable strategies to overcome them, like asking questions, breaking down complex information, and using reliable resources. Through Emily's story, we've seen how health literacy impacts real lives and how small steps can lead to big improvements. But the journey doesn't stop here. If you're ready to take your health literacy skills to the next level, we invite you to explore more resources. Visit Unimed Academy to access live webinars, workshops, and other tools designed to help you grow. At Unimed Academy, We believe that health literacy is the foundation of a healthier, more confident life. Thank you for taking the time to invest in your health literacy today. Together, we can create a world where everyone feels empowered to take charge of their health. Let's keep learning, growing, and thriving. See you next time.